Come again.
Hello, and welcome to the American Massage Conference pre-conference broadcast series on Massage Therapy Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing at the American Massage Conference May 20th through 22nd, 2011. The inaugural event is being sponsored by Massage Today, Massage Envy, Massage Warehouse, and ABMP, and will be held in beautiful Atlanta, Georgia. Our special guest today is Doug Alexander. We will be talking about his class at the American Massage Conference, Introduction to Nerve Mobilization. But before we get started, let me tell you a little about Doug. Doug Alexander has been a massage therapist for over 25 years. He remains fascinated by the human body-mind and the essential role and transformative power of touch. He is a professor in the massage therapy program at Algonquin College in Ottawa and the owner of TouchU.ca, an online multimedia continuing education business for massage therapists. Doug has a keen interest in integrating science, art, and feeling in massage therapy. He is currently exploring somatics through body-mind centering and soma soul training. Doug, welcome to the American Massage Conference pre-conference broadcast series. It's wonderful to have the chance to talk with you today about your class, Introduction to Nerve Mobilization.
Thanks, Felicia. I'm excited to be here, and I'm excited to be a part of the American Massage Conference.
Well, we are really glad to have you. And before we get into your topic, I'd like to ask you why you wanted to be a part of the American Massage Conference in Atlanta.
Well, Felicia, I'm going for support and for stimulation. I'd like to share what I know with American massage therapists in person as well as online. I'd like to learn more about, I'd like to learn some new ways of thinking and feeling, which is what always happens at a conference for me. It's also the end of term for my massage students, so I'm sort of like a cork coming out of a champagne bottle. I'm just looking to get out of town and really enjoy meeting some people and getting some more stimulation.
Well, I know the American Massage Conference is going to be a lot of fun, just as the Canadian Massage Conferences, where we both were back in the fall. I'm curious, is there anything in particular, any event or activity that you're looking forward to at the American Massage Conference in Atlanta?
Well, the thing I'm most interested in is the kinesio taping course. I've taped people a fair amount through the years, just using first aid tape to help them with postural correction and as well as sort of eccentric muscle overload. But I've just done this intuitively, so it'd be nice to get a little bit of training on that and get some perspective.
I know I talked to Michael McGillicuddy a couple of weeks ago about his class there, and I, too, am really interested in it. I thought, wow, I had no idea tape could be so useful. So I think that is going to be a really interesting class among all the others, including yours. And I know people are really interested to learn about your class. So I want to just jump into your topic. I have to admit, I really don't know anything about nerve mobilization. Can you tell me what is nerve mobilization?
Well, Felicia, nerve mobilization, it's just a way of thinking about the body. We use a collection of assessment and treatment techniques that use the length, the stretchiness or elasticity, and the irritability of the nervous system as a frame of reference for treatment. When I was at massage school, I learned a treatment for carpal tunnel syndrome, and basically I learned all the significant places where the median nerve can get compressed and irritated. And then if I had somebody with carpal tunnel, I would just, lovingly tackle those places and hope for the best. So, which worked pretty well sometimes. But what nerve mobilization does, it teaches you a way of asking the nervous system from the nervous system's frame of reference. So what is it that is most irritating to you? Where are you most irritated? And what kind of treatment might be helpful for you? We use these orthopedic tests that tension, compress, and stretch the nervous system. And that's kind of unique, I guess, because we get a clear sense of where to direct our therapy. We have a great way also of measuring the effect of what we've done. So there's this whole kind of testing, treatment, and retesting kind of thing. And it's not that you test them and then you do this treatment for 45 minutes, then you retest them. You test them, decide what you want to challenge. You challenge that for like 2 or 3 minutes maybe, 4 or 5 at the most, and then you retest. So you really end up having kind of a conversation with the nervous system.
So I will admit I'm not sure I know exactly what this would look like. So can you tell me in relation to the testing, are you doing something like muscle testing, or what exactly are you testing?
Muscle testing is about function. So you're asking muscles to contract. These are more like stretches. So, everybody knows how to stretch, say, the pectoralis major. So what we're doing is we're putting the person into a stretch position that, say, for the upper limb nerves, you're actually pulling on the brachial plexus with a bias from one of the nerves, say the median nerve. So you take the slack out of the person's median nerve by extending their wrist and doing things in their elbow and stuff, and you pull out on their arm, and you pull their head the other way. And so you're really pulling on the plexus with a bias toward a particular nerve. And there's all these different positional elements that go into that. And basically you're challenging the nerve mechanically, and you're finding out where it's most vulnerable. So that's the thing, like in contrast to what I described a minute ago around treating someone with carpal tunnel, just treating all the interfaces and hoping for the best. We're actually asking the nervous system, what interface or what muscle or ligament or whatever is most provocative for you. So it's kind of cool. It looks like stretching, but it's got all these different component movements to it that put particular emphasis upon the nerves you're interested in. Does that help a bit?
It does. I have a much clearer picture. I was thinking, wow, I feel stupid here, and I know I can't be the only one, but now that you've explained it, that definitely helps. Can you tell me, what's the basis for nerve mobilization, or how did it come about?
Yeah, well, basically the whole idea of challenging the nervous system this way, sort of a medical or allopathic thing that the physiotherapists, particularly in Australia, really went a long ways into. So I think it's probably about 20 years ago I got a book by a physio in Australia, David Butler, Introduction to Nerve Mobilization. And, Mobilization of the Nervous System. I can't remember the name. Anyways, it's Churchill Livingston, bestseller. But it's very much a physio approach. So, but he sort of, he's really advanced this whole thing about how to perform these tests and interpret them. But as a massage therapist, I perform these tests, and then I do massage-type things. So the way I perform nerve mobilization is quite a sort of a broad-based thing where, we'll go into it again a little bit later in terms of the kind of techniques we do and so on. But basically it comes from physios. It's been modified by a massage therapist to fit the way massage therapists think and the way we feel and the kinds of things we do with our hands. Gotcha.
So obviously some people are going to be intrigued by this and think that it might be something useful for their clients, but they may not know exactly who would be, who they would want to do this on. So why don't we start by finding out if there are particular kinds of symptoms, see if I can spit the word out, symptoms present that indicate the need to do nerve mobilization.
Right. You would think about nerve mobilization whenever someone has neurological symptoms. So those are things like tingling, numbness, zingy, toothache, odd kind of feelings that we tend to only feel if we hit our funny bone or if something goes awry in our spine. So when people have symptoms like that, and if they're coming from the peripheral nerve, then it means that there's an issue with the nerve that its conduction is being affected. So nerves are like coaxial cable. You've got this sheath around them that's protective, and then you've got the information electrochemical conducting elements, which are inside. So just like if you have a Cablevision cable, to your TV, you can jump up and down on the cable, and you would expect that your TV is not going to flicker. So the sheath protects that. So if you've got tingly, nummy problems, then you've got problems with the conductive elements. So you need to look at the nervous system this way. And also, you could have sheath problems. So you could have the sheath is connective tissue. So if you've got achy, pulley, pressure kind of symptoms, things that sort of sound, when you hear about them from the client, they sound myofascial, But if you proceed with all your myofascial techniques and so on, and you're like, wow, these myofascial symptoms are getting, 70% better, but I just can't get my fingers on it, then you probably have a sheath problem, and then you would, use these evaluations.
I love your adjectives: tingly, nummy, achy, pulley.
It's fun to say. It's not so much fun to feel.
Right. Well, anybody that's had pain that originated from a nerve issue is definitely aware that none of those are fun. They might sound cutesy in the way you're describing them, but they don't feel that way at all.
No, people can really be stuck between a rock and a hard place.
Oh, for sure. Well, for people that are experiencing these pains, how do you determine where the client needs the treatment the most? I know you talked about the test, but how do you determine that? And what interventions are indicated for that, or treatments are indicated?
Okay. Yeah, I briefly covered the idea of the neural tension tests, or these provocative tests. Maybe just to clarify a little bit further, when people are thinking about like that pectoralis major stretch that's modified with extending your wrist backward and supinating your forearm, extending the elbow, and things you do in the neck and so on, you create a situation in the client's experience where you are increasing the symptoms that they feel, and you have to do this very judiciously. So you set up their body and the tension and compression on the nerve so that you're just revving the symptoms up a little bit.
Okay.
And when you're in that zone, in that sort of positional place with the person, then you take away and add back in again all the various sensitizing movements. So if I extend the person's wrist, and that's extremely provocative, whereas if I supinate their forearm, it doesn't make them much worse, then I'd say the nerve's experience at the wrist is that it's much more vulnerable to compression. So I add and take away all these movements, and I get a hierarchical list of interfaces or locations where the nerve is most grumpy. And then, so I've got a location from that, and then I combine that with the person's irritability level. So a healthy nerve, you do this stuff, and you're going to create conduction issues, but they'll go away instantaneously as soon as you take the tension or the compression off. But let's say you do this tension test, and you do it, with good handling skills, and the person's symptoms thrum through their body for several seconds or horribly maybe minutes. When that's the situation, then there's the idea is that the nerve is either swollen inside, so there's intraneural swelling, and or swelling around the nerve, which creates this irritability. It's either that or they've got central excitation, so that in their spinal cord they've got a rut dug, sort of electrochemical glial cell approximating their nerve, whatever. They've got this rut in their cord. So the rut in the cord facilitation thing I'm not addressing right now, but this idea that they've got swelling in and around the nerve you can address through various types of fluid dynamic techniques, of milking fluid proximal through the nerve, or milking the fluid around the nerve, and so on. So what you've got is you've got an idea of where you want to treat the nerve. You've got an idea based on irritability of the type of technique. There's other things that come up, say if you've just got, let's say, like sheath symptoms, achy pulley pressure at a certain interface, then you've got a problem with the sheath. So you might want to floss the sheath relative to the interface or things like that. So in a training, basically you look at all the different types of symptoms, and I basically introduce people to a palette, a palette of strategies that they can use depending upon, the symptom pattern that people experience. Does that make some sense, I hope?
It does make sense. It
sounds like a lot of words.
Well, well, it's clearly, honestly, I don't do a lot of work with that type of neurological issue. That's the kind of thing where in my own practice I tend to say, oh, this is perhaps out of my range. But what you're telling me, I think, is that it is actually something I could treat, or at least begin to treat. It may not be something I can additionally or eventually affect. It may be something that's a larger problem, but there are ways to find out what's going on and to address those problems through massage.
Exactly. And it's really important to have some guidelines about how to avoid hurting people. So if all you learn is how to be, more judicious, then, that's helpful. But I'm a firm believer that, if any one therapy did everything, then that's what we'd all be doing. And patently that's not the case. So I really feel there's a responsibility to explain or to try to understand, and for me it's an evolving understanding, what types of systems and what ways I can have an effect, and as clearly as I can notice the boundary between what I can affect and what I can't and what people need help with. So, that's part of the thing too. I guess that's the complex way of saying keeping an eye out for referral issues and having an idea about that.
Right. Well, it's exciting.
If I can make it complicated, I can do that.
Right. It's exciting to know that there is help for nerve issues through massage. I'm curious, Doug, how did you actually become interested in nerve compression and irritation syndromes?
That's a great question. I teach at a community college in Ottawa, and massage therapists in Canada are trained to treat true neuropathies, nerves that have been severed by gunshot wounds and so on. This came about because massage therapy originated just after the Second World War, and we had a lot of people coming home with these types of injuries. So we had a very kind of old-school physio approach to this stuff. Because, of course, you've got a nerve that's sutured. You don't want to pull that puppy apart. But you've also got, thankfully, we don't have as many gunshot wounds and so on these days we did after the Second World War. Right. But we have a lot of people whose nerves are compromised by compression and inflammation and so on. So one of those was I was just preparing, actually, for this lecture in lab, and I was putting my kid to bed, and we were goofing around, and he smashed his elbow on the bedpost. The inside of his elbow is funny bone, and he's crying, and this guy's tough as nails. But he wouldn't settle in, so eventually, I put him to bed anyways. And the next morning, I'm asking, how are you doing? And he goes, oh, fine. How's your elbow? Fine. He said, but I can't feel anything, on the two smaller fingers of my hand. And I thought, that's so fascinating. So then I kind of neglected him for a couple days around bedtime, but then finally I was putting him to bed again, and I thought, wow, maybe I should check this out. And there was some swelling around the entrance to the cubital tunnel at his elbow where the ulnar nerve goes. So I milked some of that swelling along, and I just kind of stumbled around. And the next day he had full feeling in 4 of his fingers. There was just 1 finger left. And then a couple of days later I treated them again, and he was fine. So the message I got was that there was he had a problem, and there was latency. He wasn't getting over it. I did something therapeutic, and there was a stepwise improvement in his symptoms. And then he was stuck again. He needed more help. So this was so exciting for me because I thought, nerves are not just something to be terrified about. We can actually have an effect on them and have an effect on, really gross conductive, properties. So that's how I got started. And I'd had Butler's book for 5 or 6 years at that point, but that's when I really started pursuing things in more detail and practicing within my practice. So
right.
That's how I got rolling.
And within your house, evidently, too.
I'm sorry,
Within your house, within your family, you're practicing on
sure.
your son.
Yeah, all my kids have been lovingly and ruthlessly treated by me.
I'm sure. I'm sure. Well, we all end up practicing on those that are close to us when we're trying to learn new techniques or perfect things. And so we're lucky that we have them around as practice subjects.
Yeah, we are lucky.
So for people that are interested in taking your course and learning about this, is there any particular type of training or modality that they need as a prerequisite to doing this type of work?
Yeah, I don't know the American massage therapy educational system as well as Canada. So any entry-level Canadian therapist would be good to go in terms of learning this. But I would say that people need to have a fairly precise anatomical knowledge base. Although, if I'm teaching or, you're studying my DVDs or something, the anatomy that's salient is presented there. I guess the other thing I'd say is that it's about a way of thinking about people. So it's a clinical reasoning approach. So if you're a therapist that really, sort of drops into a really meditative state, and that's almost the beginning, middle, and end of what you do with people, then it's probably not for you. So it fits with people who, are really curious on an intellectual basis, as well as like fully present, in their hands. Some anatomical knowledge and sort of a curiosity of blending, thought and feeling when they're working, I think is about all people need.
Well, that clinical assessment sounds like it's an important part of this because you're having to learn about exactly where the pain is and what the qualities are and the severity. And then as you're doing the testing that you're talking about, you're continuing to get feedback from the client or patient about how that's affecting them. And you're basically solving a puzzle or trying to solve a puzzle to figure out, okay, where's the bad spot, or where are the bad spots? Where do I need to go in and fix things or address things?
Yeah, and you're really, let's say someone's got, carpal tunnel syndrome again. Let's say they got their pectoralis minor is terrible. It's really short and it's really grumpy. But unless you have the nerves, what is your experience of pectoralis minor, you don't know. So you could have a pretty high tone pec minor and not have it be an issue as far as the nervous system's concerned. So it's really it's an inquisitive thing. And I'm telling you, I've dropped the ball a million times by not inquiring. So I've got a lot of space, for people who have a preferred way of working. But if you really care about people, then you're going to be really brought up short often. I certainly have, and thinking, I need to think like a little bit more clearly about this. So.
Right, and maybe not just falling into habits of, oh, well, this is what I always do, but...
Oh, we're such creatures of habit, myself included. Oh, yeah.
Right. I don't know that we've talked about it today, Doug, but what exactly are you going to be doing in this class? Is this going to be just an overview, or are you going to be doing any demonstration? What are you going to cover in Atlanta?
Well, I got 3 hours to get on people's nerves. I just love teaching people that don't say, is this on the exam? Anyways, what we're going to do is I'll do an overview of the nervous system and some of its mechanical, like sort of neurobiomechanical properties, so people have an idea, particularly around like the coaxial cable metaphor, the sheath, and the conductive elements. Then we'll create symptoms in each other. So we'll work on the median nerve. So we'll drag on each other's brachial plexus with the median nerve kind of pulling. And then we'll really highlight all the different perceptions, like what are people feeling and how to interpret the feeling. And then there's a bunch of stuff around communication skills. So I've done this a lot. And I honestly, I don't know what people are feeling. I mean, I have a very good idea, but I try not to make assumptions. I ask them, so what do you feel? So that's the conductive stuff or the sheath stuff. Where do you feel it? Because when you jump on a nerve, you might feel the effects far distal. And how long does it take to go away? So there's this communication stuff, and that's vital. Otherwise, someone's going to get hurt. I don't want to go to Atlanta and hurt anyone. So we're going to be safe first and understand how to do this stuff. And then we'll work with a few interfaces that are significant or commonly significant around the median nerve. And we'll do a variety of techniques. We'll check a little bit of each of those little, the colors of the treatment palette. So we'll do some fluid dynamic techniques. We'll decompress some interfaces. We'll stretch, some connective tissue that commonly compresses the median nerve. We'll do some flossing. You can actually floss nerves, like you should be flossing your teeth.
Right.
So that's sort of what we're going to do. I've got an online course that'll be published around the same time. That's National Certification Board certified, and people will be able to go online and see all the technical performances and have a little manual and stuff. And if they want to take a test, there's a test for that too. So that's what I intend to do. Yeah.
Well, it sounds like it's a good introduction, but I imagine that that this is really that is what this is. It's an introduction to these techniques and ideas, and that people are going to probably want to pursue more training. This is not the end-all, be-all, total knowledge base that you're going to need for doing this type of work.
No, so exactly. People, there will be some people who just hit the ground running. They're like, wow, thanks a lot, man. I know the way the nerves go. They're on this side of that joint and that side of this one, and they're going to run with it. For those people, I'm certainly going to be introducing the concepts and the practices around communication and handling skills that will ensure that, if they follow those, that they're going to be as safe as they can be. There is the possibility of harm, eh? If you overstretch a muscle, that can be really sore. If you overstretch a nerve that's irritable, it may not be a day or two. It could be a week, or two that it takes for that person to settle down if you handle them poorly. So, the safety concerns are significant. If people want to learn more, then I've got 2 DVDs out through Real Bodywork. You can get them through them or through my website, TouchU, TouChu, the letter U, .ca, not .com, .ca. I also teach workshops, and I am National Certification Board certified, but I need to have a visa to teach and be paid to teach, and it's nice to be paid if I'm going to teach in the States. So we'll see what happens on that visa thing. But at my website, there's a number of nerve mobilization related courses, as well as like sweet super courses in other areas.
I know that people are going to definitely want to take a look at those and learn more about it. In closing, I'd just like to ask if you have any other advice for people who are interested in providing this kind of treatment option to their clients or patients.
I would get Butler's book, his first book. His second one is not as helpful for massage therapists. I'd get at least one of my DVDs. And really, I don't know how it goes exactly in the States, but, I'm licensed to practice in Ontario, in the province of Ontario, and that's all I'm doing, eh? I don't know everything. I'm practicing. So there's, my knowledge and my skills are at such a level that, that I'm, very safe, and I'm probably going to be pretty effective, but I'm practicing. So if you're inquisitive, crack out your anatomy book and get a little bit of education in one of these resources and cautiously practice. I would say that there has been an approach to nerve mobilization that's been really about like doing orthopedic stretching of the nerves, and that's something you should avoid. You should definitely not do that unless you really know what you're doing, and you don't get to that until you work with fluid dynamic techniques and the interfaces and so on. So don't stretch anyone's nerves, please, until you know more what you're doing.
Well, that's great advice, Doug. And I know that a lot of people are going to want to come to Atlanta and learn more about your class and what you're doing. And I want to share that information with everybody on how they can attend the American Massage Conference. So, everybody, I want to specifically invite you to come to the first American Massage Conference that's been put together by Scott Dartnell and his incredible team, Angie, Robin, Lorna, and Monica. They've done such a great job in putting together an event that is going to be fun-filled, education-packed, and a tremendous value. Only $40 gets you access to 25 free one-hour CE classes, as well as the trade show where top massage product and equipment manufacturers are going to be ready and waiting to talk to you about how their products and equipment can help you in your practice. In addition, that $40 registration gets you a ticket to win potentially thousands of dollars in door prizes. This is an incredible stash of stuff, y'all. You've got to check it out. That $40 for a raffle ticket to give you just a chance to win these things is worth it all by itself. But, of course, you get access to the conference and trade show and so much more, including the first ever National Massage Therapy Job Fair. It's going to be held on Sunday the 22nd from 1 until 5 p.m. And this job fair is not just for people who live in Atlanta. It is a national job fair. There will be employers on hand with national, state, and local companies. So please bring your resume, look your best, be ready to talk to these employers about possible employment. You could walk away from the American Massage Conference with a new job. And for any employers who are interested in participating, we are still taking interest in that. So please, if you want to participate, please contact us through the Job Fair tab at www.americanmassageconference.com. In addition, there will be over 100 hours of continuing education available from a variety of instructors, including Doug, through 3-hour, full-day, and 2-day workshops. So you can register for these when you register for the at-large conference. For students, we also have a free student day, including a Smart from the Start presentation, where there are still spaces available. And Laura Allen will be teaching a free full-day class on how to pass massage certification exams such as the MBLEX and NCB exams. This is sponsored by ABMP and comes with a free copy of her book donated by Lippincott for the first 70 people in the class. Now, all attendees are invited to come to the Saturday night gala with food, drinks, and live entertainment. This is a limited availability event, so please be sure to get your tickets for it when you register for the conference. As I've mentioned, this whole conference has been made at an incredible value to you, and that includes the conference hotel. For only $121 a night, you can stay on site at the conference hotel where everything is happening, and you can split that rate with up to 3 other people. You definitely want to be in the hotel where the conference is if you can, because that's where all the fun is going to be taking place. As a reminder to everyone, this year's show guide will make up the center spread of Massage Today's May issue. This is going out to over 62,000 massage therapists through Massage Today's circulation and will also be available free at the show. The show guide is going to tell you about everything that's going on at the show, what's happening when, and you want to make sure to pick that up. So be on the lookout for it in your mailbox or pick it up when you come to the conference. Of course, the American Massage Conference could not happen without the support of all of our global sponsors, including Massage Envy, Massage Warehouse, ABMP, and Massage Today. We thank all of them for their support in this year's event. Now, if you're ready to register for the American Massage Conference, May 20th through 22nd in Atlanta, Georgia, meet Doug and attend his class as well as the classes of the other amazing presenters at this year's event. There are now 2 ways to do so. First, you can register and pick your courses by phone for the American Massage Conference. Your call is free, and operators are waiting to talk to you. That number is, and I'll say it twice so you can jot it down, it's 877-788-3078, 877-788-3078. And if you prefer to register online, just visit the official conference website at www.americanmassageconference.com. We also invite you to stay connected with us on Facebook at www.facebook.com/American Massage Conference. I hope after today's discussion that everyone listening is ready to come to Atlanta for Doug's class, Introduction to Nerve Mobilization. Doug, thanks so much for taking the time to be with us today and for sharing your time and knowledge about this topic. I'm looking forward to seeing you in Atlanta and hopefully checking out your class at the American Massage Conference.
Well, Felicia, thanks for having me on the radio and at the conference. I'm looking forward to meeting everyone and having lots of fun and learning lots myself.
Well, it's going to be a great time. Everybody, this is Felicia Brown, and on behalf of everyone from the American Massage Conference and Massage Therapy Radio, I want to thank you for tuning into this broadcast of the American Massage Conference pre-conference broadcast series. Please remember to check back for upcoming interviews each week between now and May 20th. We look forward to seeing you in Atlanta in May. Thanks again for tuning in, and have a fabulous day.
Come again.
Let there be plenty. Let there be plenty love. Let